After removing products from the sterilization package, insert the new reload by sliding it against the bottom of the reload seat at an angle of 30 degrees until the reload alignment tab stops in the reload alignment slot. Snap the reload securely in place. Remove the shipping wedge when you use it. Close the jaw of the stapler by squeezing the closing trigger until it locks in place. An audible click indicates that the closing trigger is locked. Introduce the stapler into the body cavity through the trocar. The stapler jaw must be visible past the trocar sleeve before opening the jaw. Press the anvil release button to reopen the stapler jaw and return the closing trigger to its original position. Adjust the stapler to the surgery position by the rotating knob freely. Pull the fins of the rotating knob back and select an appropriate surface to use as a grounding surface to bend the jaw. Once the desired articulation angle is reached, release the rotating knob to lock the angle. The stapler will only lock at predetermined angles 15 degrees, 30 degrees, and 45 degrees. Position the stapler around the tissue to be stapled. Ensure that the tissue lies flat and is positioned properly between the black lines of the jaw. Close the jaw totally by squeezing the closing trigger. Holding the jaw in place for 15 seconds after closing and prior to firing may result in better staple formation. The complete firing action requires 4 complete strokes to cut the full reload length and return the knife to its home position. For each stroke, squeeze and release the firing trigger completely with a continuous, smooth stroke. Press the anvil release button to separate the stapler jaw and allow both triggers to return to their original positions. Gently pull the stapler away from the transected tissue and examine the staple lines. Pull on the fins of the rotating knob. The jaw will return to the straight position automatically. Then squeeze the closing trigger to close the jaw. Withdraw the stapler from the body cavity completely. Remove the used reload. Push upward toward the anvil to unsnap the reload from the reload jaw. Discard the used reload. Before reloading the stapler, rinse the anvil and reload jaw in sterile solution to clean the anvil and reload jaw. Do not use the stapler until it has been visually inspected to confirm there are no staples on the anvil and reload jaw.